Today we will discuss about Enterobius vermicularis. It's one of the most common nematode infection in the world, commonly called as pinworm and also called as enterobiasis. This is the name of disease caused by this parasite. Originally, it was named Oxyuris vermicularis, but now known as Enterobius vermicularis. Humans are the only natural host for this infection, and transmission occurs in people who are living in crowded environments, and usually occurs within families, large gatherings also. The worms are tiny, thread-like, and whitish in appearance, and in the diagram you can see pin-like structure. That's why they are known as called as pinworm. This diagram is of a female worm. Pinworm infection usually occurs in children's, and they transmit via direct contact with contaminated items or even during sexual contact also. Most infections are asymptomatic, while the cure rate is very high in case of this parasite. Reoccurrence is very common, and the risk factors for pinworm that include poor hygiene, eating after touching contaminated items, and living with an individual who is identified as egg positive. Egg positive is because diagnostic procedure is mainly based on the egg diagnosis. And morphologically, the size of female is larger than a male. They present worldwide. They comes under nematode group of parasite. They are intestinal parasite. They mainly attack intestinal area of humans, and the body is round, cylindrical ends, and a complete digestive system including mouth and anus. They distributed worldwide, and the disease is spread between people by pinworm eggs. The eggs initially occur around the anus and can survive for up to 3 weeks. It's a specific character of eggs. They can survive in normal environment. They may be swallowed following contaminated of the hands, food, or other articles. These all are transmission procedures. Those at risk are those who go to schools, live in a healthcare institution like or prison, or take care of people who are infected like nurses and paramedics. The animal do not spread the disease. It's a plus point. And diagnosis is by seeing the worms, which are about 1 centimeter long, or the eggs under a microscope. You can see in low power microscope, like जैसे आप स्टूल स्टेनिंग कॉमनली करते हैं प्रैक्टिकल में, तो that in that case 40x is sufficient, more than sufficient. And morphologically, the body is covered with a highly resistant coating called cuticle. The male worm is inconspicuous and has a length of 2 to 5 mm, and the size of female is larger than male, that is 8 to 13 mm. These pinworm infection commonly occur in all part of worlds. They are the most common type of worm infection in the developed world. They mostly infect school-aged children. That is very common is United States. Here in this diagram you can see a female pinworm, adult form. You can see pin ends, that's why called as pinworm. Now we will discuss about life cycle, very important part of every parasite. That in the diagram you can see begins with eggs being ingested, and the eggs hatch in the duodenum, first part of intestine, small intestine. After that, the emerging pinworm larvae grow rapidly and they increase to the size of 140 to 150 mm, and then they migrate through the small intestine towards the colon. During this migration, they develop twice and become adult. And there is a specific character that female survive for 5 to 13 weeks and male about 7 weeks only. The male and female pinworm mate in ileum, whereafter the male usually die and passed out with stool. The gravid female pinworm settle in the ileum where they attach themselves to the mucosa, inner wall of intestine, and ingest colonic contents. Almost the entire body of a gravid female becomes filled with eggs, and the number of eggs in a gravid female pinworm ranges from 11,000 to 16,000. The egg laying process begins approximately 5 weeks after initial ingestion of pinworm eggs by the human host. The gravid female pinworms migrate through the colon towards the rectum at a rate of 12 to 14 centimeter per hour. This is a very important point related to your MCQs and theory exams. The emerge from the anus, and while moving on the skin near the anus, the female pinworms deposit eggs for contracting and is expanding, eggs dying and then disintegrating and bodily rupture due to the host scratching the worms. After depositing the eggs, the female become opaque and dies. The reason the female emerges from the anus is to obtain the oxygen that is necessary for maturation of eggs. Diagnosis part is completely dependent on the finding of eggs or the adult pinworm. The individual eggs are invisible to the naked eye, but they can be seen using a low power microscope, as I told you earlier, similar like stool staining. On the other hand, the light yellowish thread like adult pinworm are clearly visualized, detectable, usually during the night when they move near the anus or on toilet papers. Transparent, you can also use transparent adhesive tape for isolating the eggs for diagnosis. Here you can see some common points like humans are the host, infection occur by ingesting eggs, and fertilization occurs in the colon. After that, male dies. So these are the all important points related to life cycle of this parasite. Here you can also see some related points related to the life cycle, like gravid female migrate nocturnally, means nighttime movement to the anal area and lay eggs. The eggs become infectious within 6 hours. They can infect a person after 6 hours. The movement of the female worm and the eggs cause itching. So these are the some important points. Now pathogenesis and clinical features. 1/3 of individuals with pinworm infection are totally asymptomatic. There is no symptom. That is a negative point related to this disease. The main symptom in most cases are itching and the around the anal area and perianum area. The itching occurs mainly during the night because earlier, as we discussed, the female laid egg in the night and caused by the female pinworm migration to lay eggs around the anus. Both the migrating females and the clumps of eggs are irritating, but the mechanism caused the intense pruritus have not been explained, but it comes under a common symptom. It is thought to be an allergic reaction, similar like allergy, due to the presence of either the female or the eggs. Itching of the perianal and vaginal area is commonly notable, especially during night, as we discussed earlier. Weight loss is also observed in severe infections. Scratching predisposed to secondary bacterial infections due to nail cuts. That's why there is a chance of any secondary bacterial infection. Because of that excessive itching leads to continuous scratching the area around the anus, which can further results in tearing of the skin, and complications such as secondary bacterial infections, including bacterial skin inflammation and hair follicle inflammation also. General symptoms are like trouble sleeping, restlessness, bad wetting, loss of appetite, weight loss, and irritability. They can damage the skin and they do not normally migrate through tissues. However, they may move into vulva and into vagina. From there, moving to the external orifice of the uterus and onwards to the uterine cavity, fallopian tubes, and ovaries also. This can cause inflammation of the vulva and vagina, that cause vaginal discharge also and itching of the vulva. So these are the some. They can also cause UTI. That the main symptoms are painful urination, mostly in case of young girls. There are 36% chances of UTI in case of young girls. This is These are the some common symptoms and pathogenesis. So if you discuss about epidemiology, so these are some common points, like they present worldwide, most common in US. Thumb sucking and nail biting contributes the ingestion of eggs. So we can prevent by stopping these habits. And children younger than 12 years of age are most common affected groups. So now we'll discuss about diagnostic part. Here you can see in this diagram the eggs are recovered from perianal screening by using scotch tape. A transparent tape you can use for isolating the eggs, and you can diagnose the eggs by microscopic examination. Here you can see adult form and eggs in this diagram. Specific character related to diagnosis is that pinworms do not lay eggs in the feces, but sometimes eggs are deposited in the intestine. So, as such, routine examination of fecal material gives a positive diagnosis only in 5 to 15% of infective cases. So, if you want 100% diagnosis, you should have used perianal area scrapings. In a heavy infection, female pinworm may adhere to stool that pass out through the anus, and they may be detected on the surface of the stool in case of heavy infection only, not in case of mild infection. The pinworm are occasionally seen during colonoscopy on a microscopic level, and pinworm have a identifying feature of protruding ridges called as LE. So these are related to diagnostic part. These two specific points, that eggs are not found in stool and no serological test is available for diagnosis of this bacteria. Now the most important part, treatment. We can treat this infection by mebendazole and albendazole in 2 different doses. These drugs are given in 1 dose at first, and second dose is repeated after 2 weeks. You can also use some topical ointments that contain malathion. You can apply them on skin area. Everyone who lives with or take care of an infected person should also be treated at the same time, and washing personal items in hot water, and each dose of medication is recommended. Good hand washing, daily bathing in the morning, daily changing of underwear can help prevent reinfection, because reoccurrence के chances बहुत ज़्यादा होते हैं. Medication is the primary treatment for pinworm infection. They are so effective that many medical scientists regard hygienist measure as impractical. So this is about treatment part. Now last, prophylaxis. How we can prevent. You can prevent them by simple steps: hand wash, clean toilet seats, don't scratch, avoid nail biting, change underwear daily, bed linen daily, and wash the anal area in the morning. Pinworm infections cannot be totally prevented under most circumstances. This is due to the prevalence of the parasite and ease of transmission through soiled night cloths, airborne eggs, contaminated furniture, toys, and other objects. Infection may occur in the highest strata of society where hygiene and nutritional status are typically high. Prevention action revolves around personal hygiene and the cleanliness of the living quarters. The rate of reinfection can be reduced through hygienistic measures, and this is recommended especially in recurring cases. The main measures are keeping fingernails short, washing and scrubbing hands, fingers carefully, especially after defecation and before meals. So these are the points related to prophylaxis.